Namaste. Today we will be talking about a very common problem that is present in a lot of people. Yes, fatty liver has become so common that anybody undergoing an ultrasound abdomen for any reason is being diagnosed with this condition very frequently. So, what is fatty liver? Who does it affect? How important is it to diagnose and treat this condition? What are the problems of this disease? These are the things that we are going to discuss today. So, fatty liver is a condition which is because of the accumulation of an abnormal amount of fat in the liver. There is a certain amount of fat which is acceptable, maybe up to 10% of the liver's weight, maybe because of fat, that is acceptable. But when this proportion increases beyond 15%, it is being graded as grade 1, grade 2 and grade 3 fatty liver. Maybe roughly I can say that 15 to 30% may be grade 1 fatty liver, 30 to 50% may be grade 2 fatty liver, and anything more than 50% of the liver's weight, if it is because of the fatty accumulation, it is grade 3 fatty liver. So, is it very important to identify this condition? Yes, because fatty liver is turning out to be what we call as a silent epidemic. Fatty liver in a person does not produce symptoms. It remains silent in the body. But then, after years, 10 to 15 years of fat accumulation and the subsequent damage to the liver, it leads to very serious complications like liver failure and even liver cancer. Now that we know fatty liver is such an important condition, let us go into the depths to understand what causes fatty liver and who are the people who get affected by fatty liver commonly. So, like I said, fatty liver is becoming very common. Almost 20 to 30% of people who undergo ultrasound for any reason are being diagnosed with this condition, and predominantly it affects the people in middle age, in their active life. But then we also see fatty liver in children, and predominantly it is related to the body weight. Anybody who is obese, or especially what we call the body mass index more than 30, these are the people who are at very high risk for developing fatty liver. But then our country has a very special and specific entity of this disease, which is called the lean fatty liver, where fatty liver has also started being diagnosed and is being occurred in people who are otherwise very thin. So, you have to understand that fatty liver can happen with middle-aged people, children, obese, or even sometimes rarely thin people. So, what are the causes? Normally, fatty accumulation in the liver is a reaction to increased and continuous intake of alcohol. Yes, anybody who has been taking alcohol for a long time is at a very high risk of accumulation of fat in the liver. But this is a reversible condition. Once a person who has been drinking has been identified with a fatty liver, if he will stay abstinent from alcohol, stop alcohol completely, then his fatty liver would be completely reversed into a normal and healthy liver. Also, in conditions like pregnancy, there are rare instances when there is an abnormal accumulation of fat in the liver of the pregnant woman, and then it actually immediately reverses after delivery. So, we are actually interested in a condition called non-alcoholic fatty liver disease. So, anybody who does not consume alcohol but still goes on to develop a fatty liver is the predominant disease that we diagnose more commonly. So the biggest risk factor for non-alcoholic fatty liver disease is the presence of uncontrolled diabetes and poorly treated hypertension, what we call as the metabolic syndrome. Yes, these are the two main risk factors by which people develop fatty liver. The other important thing is because of our lifestyle. We all know our lifestyle has changed so much with sedentary activities taking much of our time and very poor dietary habits. Both of these are a high risk to develop fatty liver, and the symptoms of fatty liver does not produce any symptoms. So any symptom which may be attributable like a upper abdominal pain or dyspeptic symptoms like fullness and bloating sensation in the upper abdomen, belly, these are not produced by fatty liver. Fatty liver, for your understanding, does not produce any symptoms in the person who is getting affected, but then when it goes on to produce complications, then it may produce symptoms of liver disease. So what are the investigations that are available to us to detect fatty liver? One, as you all know, is the ultrasound of the abdomen, of the belly. An ultrasound scan is a very easily available tool, very widely available tool, and it may help us to identify fatty liver in almost all of the patients. To an extent, it may also help to grade the amount of fatty liver, but then in patients who need further evaluation, there are other imaging modalities like MRI or fibroscan, which may be essential to identify the exact amount of fat that may be accumulated in the liver. So the other important investigation that is required in all patients who are diagnosed with a fatty liver is the blood test, liver function analysis. So the liver function tests play a very important role in the assessment of patients with fatty liver, because if there is an abnormal liver function test along with an abnormally high accumulation of fat in the liver, it is called non-alcoholic steatohepatitis, which is an even more serious condition than a simple fatty liver. So these two investigations are the baseline for evaluation of fatty liver, and in selected patients you may require invasive investigations like a liver biopsy to exactly assess the nature of the disease. So coming on to treatment, like we said, the risk factors primarily include alcohol and lifestyle diseases. So prevention of alcohol, complete abstinence is very essential. Anybody with a fatty liver should avoid drinking, even though it may be in a social limits. And second is to have an active and healthy lifestyle where you avoid eating fried items, avoid eating very high calorie items, adding excessively amounts of refined sugars. All these should be avoided. You need to go on a high protein diet, and along with it actively exercise, which very effective regimen is to undertake 45 minutes to 60 minutes of aerobic exercise every day, like jogging, swimming, running, walking, brisk walking. All these need to be done for at least 45 to 60 minutes to a point where you will exert and have a lot of sweating. And along with diet, this itself is enough to reverse fatty liver in almost all of the patients. In people with non-alcoholic steatohepatitis, where there is an abnormality in the liver function test, these people require medicines. There are several medicines which are routinely prescribed to these patients. You have to consult your doctor to identify the need for taking these medicines. Lastly, I would like to warn all the people listening that the complications of fatty liver may be liver failure, and in severe patients can even cause liver cancer. because liver damage which happens because of fatty liver is a precursor for developing cancerous lesions in the liver. So let us all fight together in fighting against this silent epidemic, and the only way we are going to succeed in this war against fatty liver is to adapt a healthy lifestyle, eat healthy foods, and maintain an active and exercise regimen which will help us cure and even prevent fatty liver. Thank you.